At the edge of an international border, at the edge of the Pacific, at the edge of innovation, community, education, and discovery, you're listening to At the Edge of It All, a University of San Diego podcast where USD experts speak on topics and stories that impact you and the broader community.
Welcome to another episode of At the Edge of It All. I'm Lisette Martinez.
And I'm Elena Gomez.
And today we will be discussing the very sensitive issue of suicide prevention. Now, this conversation could be triggering to those watching or listening to our podcast. So we want to ensure that we provide people with the proper information in case they need to get a hold of a mental health expert because this discussion is triggering. So if you are struggling with suicidal thoughts or know anyone that is, please contact the National Suicide Prevention Hotline. That's 988. Or you can also visit their website at chat.988lifeline.org.
Today, Wednesday, September 10th, is also World Suicide Prevention Day, and this is a day to raise awareness that suicide can be prevented by engaging in honest conversations. And so today, to help us with that, is Dr. Christopher Burden. He's an Assistant Vice President for Student Wellness at the University of San Diego. Dr. Burden, you're also a clinical psychologist and oversee the university's mental health resources here at the University of San Diego. So thank you for being with us.
Thank you both for having me.
Dr. Burton, I'm going to get right into it. Now, I'm looking at some stats and I want to read some of those off. Suicide is the second leading cause of death for teens and young adults ages 10 to 34, according to the CDC report. Now, what is behind some of these stats, and what is it that they're struggling with?
There's a whole range of experiences that individuals, particularly our young adults, can be experiencing that can lead to suicidal behavior or thinking. And, chief among them is the struggles with depression and loneliness. Depression is one of the leading healthcare concerns that we have to manage when we're working with suicide prevention, but also challenges with substances like alcohol and other drugs and use. Those are also factors that can lead someone to engaging in suicidal behavior. And also, the realities of depression and loneliness are connected to feeling disconnected from communities, feeling like they're not, people aren't understanding or not their own experiences, and also just feeling experiences of conflict or loss. Loss is often connected to moments when we feel like we're having thoughts about death or dying.
And now it's interesting that you say loneliness, right? And loneliness can mean so many different things. I feel like one of the situations when we talk about mental health and suicide prevention is that a lot of times people feel like they're going through it alone, as you just mentioned, right? And that can be within your family unit, your circle of friends, just in society in general. Is that what you have found in your practice, that many people think they're struggling with things but are too afraid to say something?
Absolutely. And that's why I'm so glad we're having this conversation today, is that one of the key factors for preventing suicide is being willing to reach out, to talk, and to have a caring ear or caring person in your life be willing to carefully listen to what you're experiencing. And oftentimes stigma is connected to shame or fears about disclosing their experience, and so that just perpetuates the challenges that people with depression experience. And so it's so important to have the conversation, as was mentioned earlier, and to be able to willing to talk to someone about what they're experiencing, particularly if you're having thoughts about suicide.
I would love for you to take us through, based on your expert experience, some advice for people who may be feeling this way. What should they say? And then on the other side, what should people be listening for?
Great question. It's very important that if individuals are struggling with depression or having thoughts about death and their own death, it's important that they reach out, that they know that they can reach out in so many different forms now. It can be by phone. There are 988 text. There's multiple ways in which people can reach out and get support and access, and any way is okay. And, in some of the suicide prevention work, we often hear the phrase, there are no closed doors. So it's really important for people to be willing to listen, as you said, for distress, and be willing to have an open door for someone who is experiencing these the risk factors for suicide. And I would be listening for experiences of loss. Oftentimes people who've experienced, whether it's financial, relationship losses, any kind of losses that people experience, it can really make us have begin to feel hopeless. And we really want people to be listening for those moments in our friends or families members' lives or people in our community's lives, so that we can be there to listen, to understand, try not to immediately fix the distress that the person's experienced, but really also be willing to understand and be willing to help connect them to appropriate help and care. The experience of people minimizing someone's loss or someone's distress can really be a challenge, and so we don't want to minimize what someone's going through. We want to try to create space for them to share, and then also help connect them to appropriate care in the community.
What are some unspoken things you might see in a friend or family member or someone in your community? Maybe they're not saying it, or they're not coming to you and expressing how they're feeling, but maybe you may notice some changes in them. Are there any unspoken things to look out for from people that might be experiencing something tough?
Great question. I think that it's important to know that sometimes when folks decide to give things away, or they become they sell things that are important to them, or stop doing things that they used to do that were very meaningful, things they used to find pleasurable. Those can be signs of someone feeling an intense sense of feeling hopelessness, or feeling like they're resigned to their current situation. So those can be kind of unspoken behaviors to look for. Also, if you observe someone's substance misuse increasing, if there are changes in how they may be coping and it's less effective for them, those can be behaviors that we can observe. One of the realities that we see in the research is that there is a large percentage of folks who are thinking about suicide who will verbalize it, who will tell someone. So again, that's why it's so important for us to be able to be willing to be listeners and be able to hear what people in our families, friends, or communities are sharing with us. Because in addition to the behaviors, oftentimes there will be some verbal messages that are important for us to attend to and listen to.
Dr. Burton, you said earlier that there are some things that make people feel hopeless and suicidal, right? What if there is no specific thing? What if there is no loss? I've met people who are very much seemingly happy, have really, according to themselves, have nothing to complain about, but yet feel different and sad. And is that okay too? Are those feelings okay to feel, right? I mean, I don't know what you have to say about that, but sometimes it's not always a trigger, right, that caused it.
Yes, there are folks that people just kind of feel chronically sad, chronic thoughts of suicide, thoughts of death. The reality of those, the opportunity there for help is real, and the treatment and care approaches for chronic depression or suicidal ideation is strong. There are evidence-based treatments and medication and therapies that can help in those situations. Just to build on the question you're asking, sadly, sometimes people will share with those of us in healthcare that they were waiting to be asked about their sadness or their suicide. And so often, even sometimes individuals who seek opportunities in different healthcare settings, maybe they don't get a chance to get asked about their distress. So I think it is important not just to be looking for the signs, but if you have any inclination, it's okay to question. It's really important to know that asking someone if they're experiencing suicide or experiencing thoughts about death will not increase the chance that they will act on that. Asking questions does not cause someone to become suicidal.
That's a very important point that you make, because I feel like sometimes maybe people may be scared to even bring up the thought in case you're putting it in their head, right? As they hear sometimes. I'm so glad you said that. I also want to hear from your expertise. What do you have to say about the realm of mental health and psychology, right? Like, how would you explain it to people to make it more approachable to them. Because a lot of folks, and certainly in certain cultures too, like my own, going to the psychologist, like, oh, no, I'm not going to go to a psychologist. I'm not going to do that. But you are a doctor, it's like, it's part of an organ like anything else, right? It's part of your body. How would you describe the area of psychology, and why should people not fear going to a psychologist, but rather see it more as they go and get their checkups yearly?
I appreciate that. And the goal of conversations like this and the work that we do in psychology is to really try to help people feel like reduce the stigma and begin to see healthcare broadly, and that includes mental health care. I think those are goals we all have in psychology and in other healthcare settings, so people feel comfortable and they don't feel like it's something that they should feel embarrassed about or feel ashamed by. The other reality too is that one of the goals of suicide prevention is to really instill hope. And we want people to engage with healthcare and, for example, engage with a mental health provider and to feel a sense of hope and to find place and space for them to explore why they should be hopeful, what strengths they're bringing to their current situation, and how they can create behaviors and actions that'll help them recover from the situation or the mental health concerns that they're experiencing. So really finding more and more in psychology the importance, particularly in suicide prevention, is it's importance of finding hope together with the folks you're working with. And so I think that is not often what people think about when they think about going to the doctor or talking about suicide. It's about identifying, and it's important to know what's happening and to have diagnosis, but it's also important to discover our strengths and to find ways to cultivate hope.
Can you talk a little bit more on hope, of why that is such an important part of all of that? And sort of you touched on it a little bit about the work that goes into that, but also I think understanding that others are going through it, other people, you're not alone, right? And I don't know if that's a part of the hope journey that mental health professionals work with patients, but talk a little bit more about that.
Thanks. Yeah, I think that's important. People really need to know, and that's one of the really negative impacts of stigma, is that it forces people into disconnection and makes conversations less likely, so people think they are alone in managing this situation. We know in mental health work that that's not the case, but we need to help people realize that. And that does help people feel hopeful, because they can also encounter in groups, in support group settings and other community-based settings, they can see and connect with people who have recovered from a whole array of mental health concerns and are managing their lives with success, with poise, with grace. And so all of those realities are part of imbuing hope and are part of suicide prevention, connecting and bringing the conversations out into our communities, into our neighborhoods, so that people can know what it's that other people are aware of their own challenges, but also can help them along the way.
Mm-hmm. Doctor, do you recommend frequent mental health checks with family members and friends, but like even for those who seem happy, like, hey, how are you doing? How are you holding up? Anything bothering you? Just something like that?
Yeah, I think creating good conversation, in the question, persuade, refer, QPR model, that's one of the benefits of going through that training, is that you understand the importance of just creating good conversation and creating opportunities for people to talk. And so there are people who don't who seem like they are not in any distress, but are internally experiencing distress. And so I think it's just being very aware are there situations, other things that are happening for that person that could be stressful, that could cause some distress, even though they're not showing it? And is there a way for you to ask a caring question? Going back to what we said earlier, it's not going to increase their stress. In fact, when we ask people, are you doing okay? How are you feeling? As long as we're asking in a non-judgmental, in a truly caring way, in a way that we have time to really listen, it can create a really good opportunity for connection and for people to know that this person that I'm talking to cares in an authentic way, and it's a safe place for me to share some distress. But I think it's really on us as community members to be committed to learning those good communication skills.
And also maybe even sharing, hey, I went to see a therapist and I was dealing with this, and now I'm feeling that it helped me so much. At least sharing your own journey and being open about that, because I think a lot of us have seen therapists or have done that, and I think it helps to share that, because then you don't feel so, oh, okay, you did it. Okay, let me see if maybe it's something I could do.
Yeah, absolutely. And that's what we try to do in the prevention education work at USD, is really have our students talk to one another so they know they're not alone. And we often encourage students to share their stories in appropriate ways, and so that other students can hear, like you said, this is okay. This actually is part of a strength that I might bring to my journey in young adulthood, and it's also part of my process to grow and develop is to seek mental health care and support and experiences. So absolutely, it's important for people to talk more, and that's what gives me a lot of hope, is that we're seeing our students and our young adults be much more willing to talk about their experiences and their comfort with mental health topics, and I think that will help everyone as we go forward.
Mm-hmm. Speaking of USD, I mean, we certainly have on our campus the very age range of people who are most affected by this, right? 18 to 34, I believe it was that we said. And so let's talk about what we're doing here at USD. And for those who may not be from the San Diego area, there's other universities who have similar programming and do similar things. So this could be helpful there for those young adults. But I want to specifically talk to you about the JED Foundation. What is the JED Foundation, and how are we connected to them? Can you explain that to us?
Sure. JED Foundation is a nonprofit organization that was started by a family that was impacted by suicide. Their son died by suicide, and in the year 2000. And subsequent to that, they really worked and became committed to suicide prevention activities, particularly on college campuses. And so hundreds of colleges have engaged in the process to become a JED campus. And really the power of JED is that it's a campus-wide initiative. And at USD, we're really fortunate and blessed that we have leaders across the campus that are really supporting this work to look at all levels of our health and wellness promotion and suicide prevention efforts. Everything from how we are managing our individual counseling services and those how students can access those services, and how we can have both in-person and virtual services, for example, but also how do we talk about wellness in general? How do we really create spaces for students to address their health and wellness in other ways too, in groups and relaxation opportunities, in and life skill development workshops. So a whole range of programs and services, but also JED also wants universities and colleges to look at what are your practices and policies regarding mental health. How do you encourage new students to your campus to share their own stories or experiences of mental health, and how do they know where to access resources? So really everything from messaging and how we talk to students about mental health concerns at USD, to also delivery and service delivery, and everything in between. JED is trying to help really enhance all of those elements for any college, and including USD. So it's really a journey, a collaborative journey across the campus to try to look at how we support students from a mental health and wellness perspective, and what can we do to make it even stronger and more robust.
So what are some of the services that are offered here at the University of San Diego to help students? And I'm sure the JED Foundation, like you said, is kind of having you look at it in a new lens and making sure we're at the top tier of what we can offer students, right?
Yeah, we do a very thorough assessment of everything that's offered on campus. The JED Foundation also has focus groups with our students to hear their experiences. They also talk to different administrators on campus to see how programs and services are being executed and designed.
So this third party is assessing what it is that we're doing.
Yeah, and helping us identify the gaps, and then creating a plan to address them over this 4-year process. One of the best resources I think that I want to make sure folks at USD are aware of is our Be Well at USD resource, which is our website that has both campus and off-campus urgent response resources. Students or anyone in the community can go and click on our Talk Now a button which can link them to suicide prevention resources and counseling, both via text message versus phone and also in person. And so that it is a great place for students to see that they can access resources quickly. It also has information about all campus events that are connected to wellness and information about the various wellness offices on campus. The including our USD Timely Care offering, which is a app-based mental health resource that allows students to access a mental health counselor at any time on their personal device, and they can do it anywhere in the country, and even they can access urgent support if they are outside of the country.
Like if they're traveling abroad for school and things like that, they have that resource.
They have that resource if they're on one of our study abroad experiences, or we have students from all across the world. So if they're at home, they can access that. It's really important. We also have a range of student leader opportunities. So we know that students really benefit from hearing their peers talk about healthy behaviors and healthy wellness strategies. And so we have a range of peer education and wellness opportunities, including our wellness ambassadors, which are student leaders who are going to be in the community, who are well-versed to listen and help connect students to resources as needed. And it's another access point for our community so they can access information about health and wellness. And one of the important pieces of a good suicide prevention program is also having access for anonymous mental health screenings. And so in the last year, USD has really sought to really enhance our ability to have students connect with online mental health resources and do self-assessment that helps connect them to resources for when they're not ready to meet with someone. They can do it anonymously as well. And an important part of both JED and also our efforts this year is our question, persuade, and refer trainings.
QPR trainings.
QPR trainings, which is QPR is designed to sound a little bit like CPR, and so it's the same. It's a way for anyone in the community to get the skills that would help someone who's experiencing a mental health crisis. And so these trainings are available on our campus, both in person and virtually, for students, faculty, and staff. We've seen a lot of positive energy and excitement around these trainings, and so we've increased the amount of folks that can provide these trainings, and we've seen more of our community members decide to come and join us for these trainings. And then they will have skills that'll help them talk to someone who's experiencing a mental health concern, but also know what are the right resources and what are the appropriate next steps to help someone get support.
So like a CPR training, but for mental health.
But for mental
basically.
health. Exactly. Yep, that's right.
Can you talk to us about the Wellness Center that just opened up not too long ago?
Yes, we're really excited that we have a new physical building on campus that'll provide a really amazing hub for so many of these services and experiences.
And this is the Palomar Health Student Wellness Center, right?
The Palomar Health Student Wellness Center is a space for inclusive opportunities for students to connect with all elements of wellness, physical, mental, spiritual, and all elements that we want to make sure that students are aware of, and we want to make sure students are able to, it's a building where our staff and our wellness ambassadors and our students will welcome our students, and so they can attend to different aspects of well-being.
And we have a whole episode on that. So if you're interested in what's in the Wellness Center, maybe you have some ideas or want to get some ideas, you can go listen to that.
Yeah. You listed all of these resources, and so that is a big reason that recently USD was named the Princeton Review's 2025 Mental Health Service Honor Roll. We're on that honor roll as one of the top 16 schools in the nation with some of the best mental health resources and programming for students. But also outside of that, we also have resources for the community. We have telemental health providers that are available for our community members. We serve K through 12 students and their families, as well as veterans and military-connected individuals for a minimal cost. So that's a great resources we have. If you're listening and you're not at USD, those are some resources we have for the community.
And some other colleges may have them too. So if you don't live in this area, maybe you contact your local universities. They often have a lot of these programming too available for for the community at large.
Yes, absolutely. Also, something for the community is USD is a partner for International Survivors of Suicide Loss Day on November 15th. We co-sponsored this event with the American Foundation for Suicide Prevention. And this just plays an important part in prevention and also brings people together who have experienced death by suicide in their community. So tell us about this event.
Thanks for asking about it. It's an event that we've sponsored, co-sponsored with for the last several years, and it's an opportunity for individuals who've been impacted by suicide to come together, to build connection, to learn, and also it really is an opportunity to build hope. And so it's a conference-style event that has structured opportunities for people who have been impacted or had an experience of suicide that has impacted them to talk to one another, get good information, and also, like I said earlier, build communities so that, again, like it's very important for folks to know they're not alone. And individuals who've been impacted by suicide have a lot to offer the community and a lot of information to share, and oftentimes they can be wonderful allies and ambassadors in suicide prevention work. So it also builds a network for that, and we're really proud to have that event on our campus.
I want to ask you one last question about the importance of storytelling in providing hope, right? How powerful is it? You mentioned earlier that, study shows that young adults like to hear from other young adults, right, about their experiences. But can you get more into the importance of telling your story? There's so many cases I've read where people were on the brink of suicide or tried to commit suicide, and they came around. They saw the light at the end of the tunnel and now help others, to inspire others and give others hope. How important is it to speak up, to tell your story?
It's vitally important to engage individuals who have recovered or are in recovery from mental health, to create space for them to share in appropriate ways how they're navigating and how they've created opportunities for themselves, and how their behavior and their engagement with treatment and care has created hope for themselves, and that hope will also help others in the community. It's really important that we hear stories of people who have navigated the challenges, which are very real and can be very daunting, but we know there is very effective treatment, there's effective medication and care, and we know what helps, and suicide is amongst the most preventable causes of death that we have in healthcare. And so talking about it, engaging folks who are committed to helping us all together work on this health concern is all about creating community and building hope and creating space for people's stories.
Now, how do we do this responsibly? How do we seek people's stories responsibly, and how do we tell stories responsibly? Because we don't want to re-traumatize, people who are constantly telling their story. I mean, could that affect them too? How do we go about telling the story so they're not re-affected every time they tell it?
Yeah, I think you have to be very careful about hearing those narratives, and certainly you would never want to encourage someone without careful conversation and work with their own professional work. So I think it's more about us telling those of us who are in the prevention and education work, just finding appropriate ways to share hopeful narratives, to show to help us create opportunities for people to be engaged in community. But I agree, we have to be very careful. We wouldn't want people to share, because people can be at different points of their own journey.
Correct.
And really people who are sharing their stories, it's when they've integrated and really established positive behavior changes. So oftentimes that's takes a long time, and that's okay. But when students or people engage in different kinds of experiences, like the International Survivors of Suicide Loss Day, those are all very trauma-informed experiences. We want to honor all what we know about trauma-informed care and conversation. So just making sure that you're working with good, effective care, and also engaging with really good organizations which exist in the community.
Wonderful. Well, Dr. Burden, thank you so much for this very important conversation. You gave a lot of insightful resources for people, and most importantly, sharing that there is hope. You're not alone. There are mental resources in our community and people willing to help.
Yeah, I have the privilege of working alongside committed professionals every day and throughout the course of my career. So I know I can say authentically for folks that are impacted by mental health distress that there are caring, skilled people who are willing and available to walk with you and to help you imbue the hope and imbue the skills and the care that will help you move to the next place in your journey. And so I just want people to know that, and we will hold that. I hold that in my mind as we know that people are struggling, but know that there is hope, and there are people there that are willing and committed to help them in the next stage of their recovery.
And I just want to share something since we talk about the power of storytelling. When I came to school here, I struggled with my mental health like many freshmen do, right? And I went to the center for, to the wellness center here at that time. It was a long time ago. And I, kept with a psychologist throughout my 4 years here. And it was the best thing that I ever did for myself. I haven't been healthier and happier since, and it provided me with a lot of tools that I took with me in life in my toolbox, that whenever I needed again, I was able to use the tools that I was provided and that I learned here while I was going through therapy and seeing my psychologist. So it's very important. Hope is there. Life does get better, but you have to seek help and be willing to get help. And so I encourage everyone, especially if you are in a college campus, there's so many wonderful people waiting to just help you. I thank you, and for all the people that work with you, because I know you guys do a lot, and I hope you're taking care of your mental health too, all of you and your colleagues, right?
We all do. Yes.
And we don't want to leave people without resources. Yep. So if anyone, after listening to this conversation, wants to know more, wants to know resources, or is feeling triggered in any way, where can they call again? Can you remind us? And where can they find more resources for JED, for example, if they're on a college campus?
Nationally, which is the 988 Crisis and Access Line, that can be both a text or a phone call away for help or support. Also, we have the San Diego Access and Crisis Line, which is 888-724-7240, which is a very important resource here locally in the San Diego County area. And also the Be Well website at USD has all of our urgent virtual and in-person resources available for the community. So just want people to know that there are resources available and that we are here and ready to support and provide care and support.
Well, again, thank you so much, Dr. Burton, for this very important conversation. And we hope that our audience really finds this helpful for themselves or anyone around them.
Thank you both.
And if you're interested in listening to other episodes like this, be sure to subscribe.